The fetal skull, again, just has more separations because the sutures aren't fused yet. So you might have learned this in lecture. Remember, this is the anterior part, the frontal bones. So you have this area called the anterior fontanelle. It's you can feel the blood pulsing through here. That's why they call it a fontanelle. And there's a mastoid fontanelle on the lateral between the occipital, temporal, and parietal. And there's a posterior fontanelle right here. So those are the ones you need to know. And the bones are basically the same, just that the fontanelles are present. And you should take a look just to see the difference in the shape, basically, of the fetal skull versus the adult skull, or child skull too. So fetal, of course, is after embryo, so after 8 weeks of development, all the way up until the delivery of the baby, this fetus. So the vertebral column, there's 24 vertebrae, and you'll see the regions we'll go through and the ones you need to know. So the top region is cervical vertebrae, and there's 7 cervical vertebrae, and they're counted downward from 1 through 7. So C1 articulates with those little slippers that I mentioned before, the occipital condyles. Another name for the C1 is called atlas, which makes sense, right? It's on top. Atlas. So you can say either on the practical, and you will see it on the practical, the atlas. It's an irregular vertebrae that looks like nothing else, and C2 as well. Thoracic, very straightforward. There's 12 vertebrae, and they're counted down, T1 to T12, and this is where you have the ribs attached, both sides, ribs attached to the thoracic vertebrae. Thoracic. And lumbar is 5 of those, L1 through L5, and this is the low back, basically. And the sacrum and coccyx are basically fused, and there's no movable segments. So there's 5 sacral vertebrae, but they're all fused together. Yeah. And then in the adult, coccyx has 4 fused vertebrae. So that's the tailbone, coccyx. So get the spelling, coccyx, and let's get the visual. So here's a good view. The first picture, this is anterior. And this is lateral, right lateral. So the right view, it looks the same from both sides. Everything's paired. So you notice there's 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 fused coccygeal. So coccyx is just that little part of vestigial tail. Coccyx. And you can see the curvatures. Like here's anterior, and here's posterior. So you can see there's an anterior curve in the cervical, posterior or dorsal curve in the thoracic, and an anterior lumbar curve. Sometimes they call that lordosis, the anterior curves. Kyphosis is the posterior curves. So read through your checklist and see what's there. And here's the curvatures, just gives you a little information on that. So kyphosis is an exaggerated dorsal or posterior curve. Hunchback, Dowager's hump in people with osteoporosis. Lordosis is the sway back where your anterior lumbar curve comes way too forward. Scoliosis is a lateral curve. Scoliosis is like an S curve if you're looking at the anterior. So the curves are lateral, but you see it from the anterior. So here's some parts: the body, arch, foramen, and canals. And we'll see. We'll just get right to it. Let's just take a look. So this is a superior view of any typical vertebrae, but probably most likely this is a lumbar vertebrae. So these are really important parts. So we're looking at the top. This is anterior, and this is posterior. So posterior, I guess, is easy because you kind of have that spinous process that you could feel. Then you have these lateral transverse processes, and this is called the body or centrum sometimes. Centrum means body. And the hole in the middle is where the spinal cord is, and you'll see this back in neuro when you see the spinal cord, and that's called the vertebral foramen. Now this is lumbar, and possibly thoracic because there's no transverse foramen. So the part that connects the transverse process to the spinous process, is called the lamina. The part that connects the transverse process to the body is called pedicle. So get those two parts down. And again, you're looking at the top. Now, these are what's called facets. These are articular surfaces that are going to articulate with a rib in this case. So this is thoracic, obviously. This is going to be a thoracic vertebrae because this is an articular surface on the TP. This is not lumbar. This is a superior articulating facet, which is going to articulate with the above vertebrae. It could be thoracic, of course, or the 7th cervical. So these are articular processes and facets. Facets are the surfaces. The processes are the parts that are extending to the surfaces. You're looking at posterior view here. You can see the intervertebral disc between the lumbar vertebrae. This is L3 and L4, where they count downward. This is the left lateral view of the lumbar L1, L2, and L3. And you can see the intervertebral discs. You can see the spinous process or posterior. Remember, this is posterior. And there's a foramen between the vertebrae called the intervertebral foramen. Remember, foramen means hole. And cervical vertebrae. We'll look at those. Now, here's the key. Now, looking at cervical vertebrae, this is a typical one, not C1 or C2. Remember, they count downward. So we could say this is C3 to C7 could look like this. Now, the key with the cervical vertebrae is there's 3 holes. There's the vertebral foramen, which we saw, but cervical vertebrae have transverse foramen. And this is a hole for the vertebral artery. So that's really important. And they have like a tail fin spinous process. It's called bifid because it has 2 parts. So those are 2 things that are very important that set cervical vertebrae apart from the lumbar and thoracic. There's 3 holes, 3 foramina, 2 transverse foramen and 1 vertebral foramen, and a bifid spinous process. C1 looks like nothing you've ever seen. So here's the superior view of C1, also known as the atlas. And it doesn't have a body, there's an anterior tubercle. It doesn't have a spinous process, but it has a posterior arch. Okay, and you still have a vertebral foramen, and you still have a transverse foramen because it is cervical. And then there's posterior or lateral, you have the transverse process right here. Okay, and here's your superior articulating facet, which is going to articulate with the occipital condyles. Okay. And now C2, this is a really standout part called the dens, or it's also known as the odontoid process, and it's anterior on C2. Okay, let's take a look at that. So this is a superior view. This has a body, has a spinous process, which is bifid, has the transverse foramen and vertebral canal, but it has this anterior piece called the odontoid process or dens. And this is where the atlas vertebra will move from side to side and rotate around that axis pivot point. So here's showing you the atlas axis articulation. So see the atlas, and here's the axis, C2. And this is posterior, here's the spinous process, here's the posterior tubercle, here's the superior articulating facets, and here's the articular facet for dens is on the atlas. So the dens is C2. And there's the transverse ligament that holds it in place. It's a very important joint. So C1, especially with injuries, right? This is really important. C1, and this is C2, is that axis. And make sure you know what they look like. C7 is called the most prominent vertebrae in the cervical spine. You could probably feel it if you reach back and feel the spinous process that sticks out the most. It's going to be C7, and they call that the vertebral prominence. It's a good bony landmark when palpating where the vertebrae are. Thoracic is 12. And these don't move very much because they're bound by the rib cage. So there's 12 ribs, and I'll go through the ribs later, but they all have attachments to the thoracic vertebrae. Remember, no transverse process. And there's the vertebral foramen. Sometimes if you look from the side, you know, it kind of looks like a giraffe, right? Because the spinous process kind of goes downward. And this is a costal means rib, by the way. See, costal facet. So that's an articular surface for a rib. And body's anterior. And there are discs, intervertebral discs in the thoracic spinal column as well. The vertebral, lumbar vertebrae, I'm sorry, are thicker, and they're the heaviest, I think, of all because they hold the most weight. So they need to be thicker and more dense. So superior view. Again, this looks kind of like a moose. You look at it, right? So you see, again, you don't have to use that as a thing, but here's the body. Here's the spinous process is a little more horizontal, and the articular processes are pretty straight up and down. And if you look at the shape of the vertebral foramen, it's a little bit different. Like this one, my thoracic's a little more round than the lumbar. If you get that view, you have to see the difference. Sacrum, not much to talk about except for posterior and anterior is important. So when it comes to the sacrum and you're in MH Connect, make sure you know the anterior sacrum, which is this, and the posterior sacrum. And this is the coccyx, not the sacrum. They're two separate bones to name. So this is coccyx, not sacrum. And then there's foramen, and this is sacral foramen. Holes, right? The sternum. Let me just go through the thoracic cage we'll look at later. The sternum has three parts. And I'll show you the sternum. And you're going to have to know this. This is definitely on the practical, because all of this is sternum all the way down to here. But it has three parts. The top knot, it looks like a knot of a tie, is called the manubrium. Then the middle part is the body. And the little flap on the bottom is called xiphoid process. You have to know those three. So practice that. It's on your list. It's on the checklist for sure. Now you notice there's 12 ribs, but the first top 7 ribs, look, they're counted down to. They're called true ribs because they have an articulation right into the sternum. From 8 to 12, they're called false because they just go into this cartilage called costal cartilage. So you have to know costal cartilage is. That's hyaline cartilage. And the last two, 11 and 12, are false ribs, but they can be called floating ribs as well. 8 and 9 and 10 are not floating ribs, but they're still false. So this is an important slide to understand. And some ribs. Note, I think we have to know the costal groove. You see that in the inner part? That's where the intercostal muscles will lie. Here's the connection to the thoracic vertebrae. The head of the rib which is up here, attaches to the vertebral body. And then you have this tubercle over here, and it has a costal facet that attaches to the thoracic transverse process. So that's the ribs. And the clavicle, not much to know here, but the two things you need to know for our exam, this is first of all, this is the clavicle. So you have to go through the MH Connect and know this is a clavicle. And you have to know two things, the acromial end, which will make more sense next week. Again, this is an appendicular bone, technically. And then sternal end is towards the sternum. So this is the only thing you have to know about this. This is the sternal end, which articulates with the sternum. So that's really your limb stuff. But the ribs you have to know for today. So again, you don't have to do everything today, but please go through all the axial stuff. I just want to go back to the skull and see some other things that you might need to know. Oh yeah, the hyoid bone. There's a little bone that's on top of your larynx, has no articulations. It's called the hyoid bone. And then there's the greater horn and lesser horn, or cornu, of the hyoid bone. So that's kind of simple. Here's a good, go through the orbit, because it'll show you that process from nasal bone to maxilla to lacrimal to sphenoid, out to zygomatic. I just want to go through some foramen in the face. These are kind of easy, but we should go through them before you go into your lab. Yeah, there's a couple of foramen, like the foramen on the chin, or outside of the chin, sides of the chin. Mental means chin, so this is the mental foramen. Really important. If you look deep, I don't know if they show you here, but right here is the optic canal. And this one right here, not this. This is the superior orbital fissure. This is the inferior orbital fissure. So they might be on your list. You have to know that. Superior and inferior orbital fissure. These are important too. These are the infraorbital foramen nerves, and these are superior or supraorbital foramen. So that might be on your list. So it's definitely worth to go through that. Let's see if there's anything else before going there. Yeah, the foramen is probably the hardest thing for the skulls. So again, go into your MH Connect and go to it.